Welcome to the Filipino Nurses Association of Grand Canyon State Educational Event. Today is our first Duminar and the first of a 3 series entitled Navigating Through the Pandemic. I am very pleased and honored to introduce to you our guest speaker for today. She has shared her expertise in many of our previous educational events, making her one of our favorite speakers. Our guest speaker for today is a Catholic physician who practices here in Arizona, of course. She's a board certified in internal medicine, heads a hospital group, and currently works as a full-time taking care of patients in acute rehab centers and skilled nursing facilities. She also started a prayer motion program, which she'll probably share with us later. And it is with great pleasure to turn the screen to our speaker for today to talk about the 2020 vision, the year of clarity. Please welcome Dr. Ann Borik.
Thank you. Thank you so much, Rose. It's such a blessing, and I'm just so happy to be here to just share with you for the next hour. And what I'd like to do is really focus on the title of this talk, which is 2020, the Year of Clarity. So my goal really is to kind of tie into the idea of bringing clarity in the time that we're living right now. Everything that's going on with the coronavirus, I'm going to give a brief overview of the coronavirus and some of the things that are happening from a medical perspective and research and so forth. And then I want to move to how can we best, clear that foggy vision, if you will, so that we can be much more clear in moving forward from our health perspective for wellness, as well as from a spiritual perspective. And I want to focus on from a biblical perspective as well at the end. So next slide, let's just move right into it. Just real briefly, I'd like to open with a reading from the Gospel of Luke. I think this is very, very appropriate as we step into this, especially as we tie in the spiritual aspect. We can't think about bringing clarity in our vision, in our life, without acknowledging the presence of God. And so in the Gospel of Luke, this is what Jesus says. Jesus turns to his disciples in private, and he said, "Blessed are the eyes that see what you see. For I say to you, many prophets and kings desired to see what you see, but did not see it, and hear what you hear, but did not hear it." And so let us ask God, let us ask the Holy Spirit to come and to enlighten us so that we can see and hear what it is that he wants us to see and hear as we move forward through this pandemic year of 2020. So let's go to the next slide. I want to jump right in to the overview of coronavirus. And I thought this was appropriate. I wanted to share this. This is a book by Dean Kuntz. It's called The Eye of Darkness, and it came out in 1981. And it's interesting that, the coronavirus is an infection disease. We know all about it. It's an acute respiratory syndrome. First identified in Wuhan, China. But in this book novel, written in 1981, there was a prediction about the outbreak of coronavirus. Let's go to the next slide. I have just a simple page that was brought out of that book. And in the book, they talk about Wuhan, China. They talk about this virus that is developed and with an intent to destroy and be destructive. And so I just really wanted to open with the idea that, in 1981, there was this prediction, this outbreak. And I want to kind of leave that hanging for a minute and just to let you think about it and, as the days go on, to really try to bring some clarity to what it is we're navigating through today. I'd like to suggest that there's a spiritual war going on. And it's so important for us, number one, to recognize that, to see, to have that vision so that we can navigate through it in a way that brings us out of it whole, holier, happier, healthier. Let's go to the next slide. Just an overview of the coronavirus. I don't want to get too much involved because I know you're going to have some other lectures about COVID, but just an overview. We know that the geographical distribution is globally. The transmission is person to person through respiratory droplet. And it's interesting that there's an environmental contamination where this virus is on surfaces, and you can see there that it can stay on wood for 4 days, paper 4 days, plastic 5 days, steel, glass. So we have to be cautious. And the reason I want to bring that up, again, tying it to this whole idea of a spiritual, evil kind of a thing, we have to be very firm in who we are and oftentimes look inward because we can't see necessarily what's happening. This is a perfect example that there's viruses on a surface that we can't see. And so I just wanted to use that as an analogy. Today, there's no post-exposure prophylaxis known. Now, as time goes on, this slide was done about a month or so ago, so it's in real time. Research is continuing, but as we know right now, there's nothing that I would give you. If you came to me and said, Dr. Borik, I was exposed to the coronavirus, what do I do to take prophylactically? At this point, there's nothing that is approved. The clinical features, the incubation period for coronavirus is anywhere from 2 to 7 days. What that means is that from the time that we're exposed, if, God forbid, you're exposed to this virus, it incubates in the human body for a period of time before, number one, you get any symptoms, or number two, you show any signs or evidence of infectivity through a test. So there's that incubation period of time. Once that happens, after 2 to 7 days, usually it's about 4 days, then the symptoms can occur. And what we now know is that the majority of people that get coronavirus, that are infected with COVID-19, are very mild cases that completely recover. It says 81% here. It probably goes closer to about 88, 89%. Severe disease is defined as hypoxia, lung involvement, and that's about 15%. And then critical disease, leading to multi-organ system failure, is about, actually it's less than 5%, closer to 2 to 3%. So the risk factors for COVID is pretty clear. Anybody that's older, anybody that's immunosuppressed or compromised, anybody that has cancer, underlying kidney problems, liver problems, diabetes, lung problems, those are the risk factors. And I can tell you, working personally in a nursing home, at the height of this infection, at the height of this pandemic in Arizona, it was probably about April, May. We had several patients that were infected. It came into our unit or our building through a physical therapist. And unfortunately, that physical therapist, was working. Everybody was in lockdown, but they were going room to room working with our patients. And so one person got it, and it just kind of snowballed. But I can tell you that closer to 90% of the patients that I cared for, now the mean age was about 86, 87 years old. I had a 101-year-old patient. So, just by, if somebody's older and, is infected with this virus, it's not a death sentence by any means. Really, for all intents and purposes, it is a very mild disease. The problem is we don't have a very clear-cut way to predict who's going to get severity of illness and who's not. We just don't have that information right now. It's too new for us to be able to extrapolate, that information. So I really want to focus on the most common symptoms for presentation of coronavirus, and that is fever. Chances are, if you don't have a fever, then you probably don't have COVID. So fever and cough are probably the two biggest. And the fever is not very high, and it doesn't last for very long. It can be just a low-grade fever, 99.6, 100.5, maybe last for about a day. Sometimes it can prolong. It just, again, depends on the individual and how their body responds to this virus. Cough, fatigue, anorexia, those are pretty nonspecific. But one thing that's pretty specific is the loss of smell and taste. Now, what we mean by specificity is that if you don't have a loss of smell or taste, it doesn't mean that you don't have the infection. But if you do, then it's pretty highly specific for that process. So the serology testing, this is something that I want to spend a little bit of time on. because this is where there's a big question mark. Viral infectivity. You know, everybody that has a positive test is not infectious. So I want to kind of bring clarity to that statement. But let's go through this and then I'll explain what I mean by that. The coronavirus, it's an RNA virus, and it can be detected in 2 to 3 days before the onset of symptoms. That's why this is something that can be contagious even when somebody's asymptomatic. That's the whole deal. That's why we're told to wear masks. That's why we're, told to be very cautious, because you can infect somebody when in fact you don't have symptoms. And so there's no way to know. So we need to protect. It can remain detectable for up to 50 days after the onset of symptoms. Now, that's important because even after you have the acute onset of this disease and you run for that 7 to 14 day in isolation and you're over the disease, you can still be positive. That doesn't mean that you're infective, though. It doesn't mean that you're going to potentially infect others. And I'm going to present a little case that I just recently had this past week that'll bring clarity to that. So the RNA, the viral RNA concentration peaks in the first 5 days after onset, and then it goes down and the antibodies rise up. And we know that, there's the antigen that goes up, and then after the acute phase, it drops down and antibodies go up, and antibodies stay up for a period of time. That's the protection in the body. That's what the antibodies do. They protect us. And so there was a small study that viral replication stopped 5 to 7 days after the onset, but patients remained positive for 1 to 2 weeks. Now we're finding they can be positive even longer than 2 weeks. There remains some uncertainty as to whether a patient who is RNA positive is shedding virus or not. So let me bring some clarity by giving you a live example, a case study. So I have a patient who had coronavirus in June, did fine. Now this patient, by the way, is about 480 pounds, morbidly obese, multiple medical problems, diabetic, high blood pressure, congestive heart failure, has an ejection fraction of about 40%, so they have a weak heart, mild kidney failure that actually had, when they came to me from the hospital, the renal function had stabilized and normalized. Over time, this patient's kidney function started to get a little bit worse, and it worried me. So I ended up, sending her to the hospital for the suspicion of acute renal failure. Even after giving her some fluids, I didn't want to over-fluid hydrate her. Lo and behold, upon entry into the hospital from a nursing home, the policy is that everybody gets a test. So she was tested for coronavirus. Lo and behold, it came back positive. Now, it's important for you to understand that this patient came to me with 2 documented negative tests. So they were negative. Came, and now we have been in lockdown. There's no possibility, as far as I'm concerned, that this patient picked anything up in my facility, right? No fevers, no other symptoms other than abnormal renal function. So I sent her to the hospital, and they did a test and it came back positive. They put her on the COVID unit, and the rumor now came back to me saying that this patient is COVID positive. So to make a long story short, I connected with the hospitalist and infection disease specialist, and within the next 24 hours, every test was absolutely negative. So this patient, in fact, had continuing, ongoing detection of the RNA, but was not really acutely shedding virus. And I'm going to show you a few things that we do now that we know that are tests that give us an idea if anybody is actually infectious or not. Chest X-ray was normal, no fevers. So in fact, this patient really did not have coronavirus. But it's interesting that the hospital will count this person as an acute infection. And so one of the things, the first point that I want to bring out in bringing clarity to our 2020 vision is to recognize that everything that you hear is not accurate when it comes to, the COVID and coronavirus and all of that. So, and this is a perfect example that now, you can hear that there's 500 new cases and, 1,000 new cases or whatever the number is. It's not necessarily accurate because of cases like this. And this is only one of many patients that are readmitted into the hospital who are probably still positive if they had it, 4 months ago or 3 months ago, but they're going to be recounted. And so it's just important to know that that's not accurate. Okay, let's go to the next slide. So these are some of the features that predict worse outcome. If somebody has a low white blood cell count, lymphopenia, or the lymphocyte count is low, elevated liver enzymes, the LDH that's elevated. These are just markers. You can look at the inflammatory markers, the C-reactive protein, the D-dimer, and you can just read the rest of the list there. These are just predictive outcome measures. But at least now we know that we have access to do this. When this first hit, none of this information was really available to us. We didn't know that it was going to be a positive predictor for disease in COVID-19 because this had never really come across our desk before, if you will. And what this is the pharmacological therapy. And there's a lot of talk and buzz about different medications. One is hydroxychloroquine. And according to the slide, you can see it's in the middle, and I don't have a pointer, but you can see that hydroxychloroquine is in the middle. That's it. It inhibits RNA entry into the cell. So it's early on in the process. So this is by no means a therapy that is used for severe disease. It just isn't. It's not going to, if you have a patient that's on a ventilator that is, very severe in that 4 to 5% that we talked about, hydroxychloroquine is not the drug. Hydroxychloroquine is though, something to be considered early on. And that's where a lot of the talk came out early on when this medication, which is really used for rheumatoid arthritis, it's an anti-malarial. And I've been practicing medicine for over 20 years, and I've used this drug many, many times in my own medical practice, in patients with Sjogren's syndrome, with, rheumatoid arthritis, connective tissue disorders. In fact, I had my aunt on this medication for years. It's a very safe medicine. The only thing that we always were told and we always needed to pay attention to was that hydroxychloroquine can affect the eyes. And so anybody on this medicine always had to get their eyes checked every year. Other than that, never once were we ever concerned about a cardiac toxicity or any interaction from a cardiovascular standpoint. But lo and behold, today, this is my second 2020 vision point, is that it's not as accurate as the media makes it out to be. And our president comes out and says, in a way that is very optimistic, which is, I think, fantastic, to be optimistic in a time and not try to spread fear, to say, well, we may have something that's going to help. Let's be optimistic as a country. Let's not panic. And so for that, I'm grateful. But I got to tell you that unfortunately, even till now, I cannot get a prescription for hydroxychloroquine. They shut it down. The second point in this slide that I want to bring out is Remdesivir. And you can see that it's a little bit further down in the line. And this is something that inhibits the actually replication of the RNA. It's an IV drug. It's very promising. When we were treating our patients, this was probably about a month and a half ago, a lot of our hospitals didn't even have access to Remdesivir. So, there's a lot of stuff that's been happening very quickly, thanks to, the efforts of the task force and the people that are working to really try to make this happen. But it is available now, and I've witnessed probably 3 or 4 people that have done very well on Remdesivir, and it probably saved their life, honestly. Today, we know that our president is currently in the hospital with COVID, doing fine. But I just want to make a point that they're using Remdesivir. So we may be seeing now this drug used in an earlier stage, maybe even prophylactically, that might work. So I'm going to end there with the COVID talk. So if you have questions, mark them down. Let's go on now to the next slide. We need to navigate through this. And what I would like to suggest that there's a couple things. From a wellness perspective, let's think about, and this is now, caring for the caregiver. This is talking now to you as a caregiver, as a nurse, as a healthcare provider. What can you do to keep yourself strong? Because we need you. We need to make sure that our that our army is not sick, because you are the ones that are on the front line. We are the ones that are going to be taking care of our patients. Physical activity is so important to keep healthy. Keep healthy. Go for a walk. Get yourself moving. We got to get the blood circulating. We know that not only coronavirus, but any illness, the flu, influenza, we know that any of these illnesses that attack the body are going to attack the immune system. And it attacks when the immune system is down, when our guard is down. And so how do we bolster that immune system? Well, a few things. Good nutrition, making sure that you're getting adequate rest and getting adequate nutrition, fresh fruits and vegetables. But physical activity is so important. Music is medicine. We know that there are chemicals that are released in the brain, stress chemicals that I'm sure you know all about. Certainly I do. The cortisol and the epinephrine and the things that when we're stressed, those chemicals are surging. And what happens is that translates into premature aging. And I know when I look at my face in the mirror now after this pandemic, I'm thinking, oh my gosh, what happened? So we have to protect ourselves, to keep those stress levels down. Music is a good way to do that. It helps to boost the dopamine and boost the serotonin in the body. That's what physical activity does as well. I want to share with you something that I personally think is a great stress management, wellness kind of thing, and that's brain strategy exercises. Learn a new language, learn a new musical instrument, write poetry, learn how to paint, do any one of those things, even just paint by number. Anything that engages the right side of the brain is going to play to your benefit, especially in this pandemic, in this time of trying to stay and protect our body against the effects of stress and illness. Meditation and prayer. For me as a Catholic medical physician, I think most of you who know me and have heard me talk and know the ministry, this is the center of who we are. And I'm going to spend the remainder of the time really kind of breaking open from a biblical perspective why it is so, so important. And when it comes to prayer, we're talking about Christian prayer. So I'd like to speak from that perspective. Let's go to the next slide. So, I thought it would be very appropriate today. And one of the reasons that I named the title for this talk 2020 is because of the idea that God has his hand and controlling everything that's happening. And sometimes we forget that. Sometimes we don't see him. We don't see, we can't, see him. But I got to tell you, he is with us. God will not forsake us. Jesus is our Savior. And so from a biblical perspective, I want to turn to appropriately John 20:20. It said, he showed them his hands and his side. And then the disciples rejoiced when they saw the Lord. So a couple things about this. Let me just paint the story now. If you're familiar with the Gospel of John, the story that we're talking about is when the disciples, and we believe that the Blessed Mother, were in lockdown. This was after Jesus had been crucified. Could you imagine the fear that these people, the disciples and the Blessed Mother felt for fear that the Jews were after them and wanting to kill them as well? So we're told in Scripture that it occurred when they were in the house, the doors were locked, the disciples were for fear, and Jesus came and stood among them and said, peace be with you. And if you recall in this biblical story, Jesus even asked them to give him something to eat because he wanted them to know that he was fully there in the human form, that his physical body was there as well as his spirit, that this wasn't just a spiritual, dream, if you will. Likewise for us, when you feel locked in, when we are in quarantine, in our house, in our homes, even just within our own being, in our own mind, when you feel locked in, Jesus is able to break through the barrier, even though we don't see him, and be there. And so the message that I would like to bring from a 2020 perspective is that even though we can't see that, that God is with us, that he does have things under control, we are no doubt in a spiritual battle. and we must confront it. And one of the ways to confront it is through our faith, through prayer, through a spiritual connection.